My role is Chairman of the Prostate Cancer Foundation of Australia. We do it with the same passion and the same professionalism. Ours is a little bigger, just really for two reasons. One, we have a bigger population, and we have a much bigger geography to spread the services across. So other than that, because of that, our business is a little bit more complex, but only because of size, not for any other reason. Today's topic was to be raising the bar on treatment and support. So I'm really here today to give people a bit of an update on Prostate Cancer Foundation, but just to talk about one area of the support we're providing in Australia that may or may not be applicable in New Zealand, but it'll give you a good idea of where we're taking that, and that's got to do with prostate cancer specialty nurses. Prostate cancer specialty nurses brings me to the point this morning. It was very interesting to hear Richard talk, and Richard say he'd love to see Sue Osborne, who was around here somewhere. There she is. I would love every man suffering from prostate cancer to have a Sue Osborne in his life and or his carer's life. And in essence, that's really where prostate cancer specialty nurses fills the gap, hopefully. Prostate Cancer Foundation really has three missions: research, awareness and support. We fund about $5 or $6 million worth of research a year. It's only a small drop in the research bucket, but it helps. We do that very professionally, and we've just changed our modus operandi. For many years, we would call for submissions. They would be assessed by a peer assessment board and be allocated. And as a member of the board, our job was really just to allocate the dollars, not to assess the research. We've just started a different approach where we are now calling for submissions in areas that we would think should be researched. And we're just about to allocate some new research on that basis at the end of May. So that's our research program. Our awareness program extends to education, etc. And our support, of course, goes everywhere from support groups, where we have about 150 active support groups in Australia. We have a national outreach committee, which, because support groups only in Australia only reach a reasonably small number of men and their families in relative sense. And so we have a specialist committee that tries to reach other parts of our community segmented wise. The Aboriginal and Torres Strait Islanders, gay community, English as a second language community, and because this disease affects all sectors of our community. Interestingly, we print most of our materials in 6 languages, and on our website, the page that says things you want to know about prostate cancer, 12% of the people visit the Arabic site on the Australian site. So there's a real need for people. We're not sure if that is whether their English isn't that good. We're not sure whether they don't know parts of the anatomy in English. They might know other parts of English, but not their anatomy, or whether it's cultural. But we find that reaching people in foreign languages has been a very positive thing for us, and we'd like to try and do it even more. We have 2 other big areas of support. One is advocacy. Advocacy takes a number of forms. Like you, we're trying to solve the inequities of having prostate cancer in terms of socioeconomic conditions, availability of medical services, and recently MRIs were listed on the medical benefit scheme in Australia. So a year ago it was $500 for an MRI, and it's now free to everybody in public and private. So they're the sorts of things we try and do. Obviously, listing of drugs on the public health scheme in Australia as well. But probably what I'm here to talk about today really is our nursing program. The key issues from our nursing point of view are the ones that are reasonably obvious to you all, especially the specialists in the room. Advanced disease, increased risk of suicide. There is absolutely evidence-based that men suffering from prostate cancer are more likely to die of suicide than had they not been diagnosed. ADT obviously has complications. Younger aged people, there was someone over the back of the room today who's much younger aged diagnosis, even though the evidence this morning I think suggested 50% under the age of 60 odd, and so it's not just an old person's disease. Financial related issues. Again, the geography in Australia causes that to be a major issue. When I think the Australian land mass is, or New Zealand, I think is about 4 or 5% of the Australian land mass. So If you're in the middle of Australia, you're a long way away from high specialist care. Aboriginal Torres Strait Islanders, and I mentioned the cultural. The geography again, you have a 26% greater chance of dying with your prostate cancer if you live in a regional or outer country area of Australia than you do if you live in a metropolitan area. And that's really got to do with distance, which is something we have to try and reach those men. Our prostate cancer specialty nurses program, it started with a pilot study of 12 nurses in 2012. It costs about $400. Well, firstly, we don't appoint a nurse unless we can appoint the nurse for a 3-year period, for obvious reasons. And the cost is about $420,000 for that 3-year period for the nurse and ancillary needs, training, travel, etc. So we started with 12 nurses in 2012. We were then successful in getting Commonwealth Government funding in 2014 for 14 nurses. So the 12 went to 14 but was funded by the federal government. And for Mark's benefit, I'll talk a little bit about our process of that. It might help you next year, Mark. So then in 2017, we went back to the government and asked for an extension and an increase. And interestingly, 2 weeks before an election, we got that extension. And we got that extension and the increase. So we currently have 48 nurses placed around Australia. 28 of them are federally, nationally government funded. And the other 20 are funded internally in PCFA between a mixture of hospitals who self-fund the nurse but want the nurse to be part of our prostate cancer scheme, and I'll explain that in a minute, and then the others are funded by us internally like we fund any other program. The nurses are actually hired by the hospitals. We have a contract with each individual hospital. That's for lots of reasons, one of which is ease for us because we don't want to have payroll and we don't want to pay superannuation and all those things. Plus the nurse has to work within, of course, the confines of the procedures of those individual hospitals. So we have 48 nurses in 45 locations, so we have 45 contracts with those hospitals. But they are prostate cancer specialty nurses. They're managed by us. They report to a head of nursing within PCFA. And they are inducted by us and trained continually by us on an annual basis. So it's a sort of a hybrid. I'm also pleased to note that in 2019, this slide, which was a little bit out of date, is now been updated to the point where, again, we have an election in 2 weeks from yesterday, and we just, from a unilateral point of view, both parties have agreed to 70 nurses over the next 3 years. We've gone from 28 funded nurses and 20 of our own to 70 nurses over the next 3 years and probably 30 odd of our own. So the number will go from 48 to approximately 100. We're very, very pleased with that. And so I'll show you a little bit about how we do that in a moment. This is our prostate cancer specialty nurses programs. Look, to simplify it, it really comes back to the Sue model. You know, the prostate cancer nurse gets involved from point of diagnosis for the whole journey of that patient and his family. And they do everything in between. And as it says here, they support the information after diagnosis. They help treatment decisions. I'm sure in future they'll be helping decisions regarding radiology, oncology as well. Any of the side effects, of course, because they're then on a continual basis. It's interesting, two things come to mind. One was I was at a gathering where a prostate cancer nurse spoke, and my wife actually said, "What's the most enjoyable thing about your job? What's the thing that gets you most?" And she said, "My boys." Right? And then she started to cry. Right? So it just shows you how interested these nurses are in the lifestyle of the men and not just the medical side of them. So that reciprocates. There's a real relationship brought up between the nurse and the family. The other is that there's some discussion in Australia about having specialist metastatic nurses. And that sounds good in principle, but when someone's developed a relationship with a nurse all the way through their path, there's some illogic in why they should change. That the nurse should be better trained or should be fully trained to allow that to happen. So that's a debate that's going on at the moment. At the moment, we semi won it because the government were thinking of having some metastatic nurses, which they didn't go forward with. Nurse-led care. Well, you know, care, as you all know, is sometimes a bit like going to the gym, right? You get told to do these things, and you get told to go and have your test, and you get, you know, what was your test result? And there's a lot of people out there who don't do that. We're pretty atypical in this room, having had prostate cancer, and in actual fact following it up and being caring and being involved in our disease. There's a lot of people out there who don't. And so the nurses help in that regard. They help them get appointments. They help them with the RMDT appointments. So they do a whole lot of things, and they help us with their research. This is a little old, but there's 45 locations. There's now 48 nurses. Half are approximately metro and regional. The distribution base is half scientific, or a third scientific, a third luck, and a third money. So the process of placing a nurse is quite strict. It's like research grants. So we had a situation early on where a town didn't, their city didn't qualify, or their hospital didn't qualify because the money ran out before it got to their level. And they said, that's not fair. And so can we fund that nurse? And we said, sure. So we have a lot of communities who fund their nurses out of their local community area because their town hasn't yet qualified on the list to get a nurse. So that's why I have that. And for those who are interested, I think 15% of our nurses are male. So that's just by chance, not by design. But I think there's about 7 nurses, male nurses in our group, in our cohort. We, like the previous speaker, Jacinta spoke, you know, we also have a protocol. We also have a ongoing relationship with nurses associations. We've been a little bit behind the times because we're just about to sign an MOU with the Australian New Zealand Urological Nurses Association that came about in Brisbane. And we are also offering scholarships for nurses that aren't prostate cancer nurses to go to the La Trobe nursing course. So I see a bigger picture for us involved with nurses, not just our own prostate cancer nurses. These are the challenges, obviously, that you all have faced and that prostate cancer nurses face with their patients. They're all pretty much self-explanatory. These are just some comments based on the nurses, which you can read at your leisure. There are some comments, but not here today, on comments from patients, which are just as glowing. And this is nurses about a year ago at a training conference. So the nurses come together once or twice a year. Firstly, they're inducted before they're appointed, and then we have ongoing training at 2 levels. One's annual, one's biannual, semi-annual. This was in Sydney last year, and I don't have another slide, which I was going to show you. But back to the politics. To go from 28 nurses, which wasn't a certainty that they would be retained, to 70 nurses takes a lot of effort. Submissions to the Department of Health in Australia, submissions to the politicians. I think we made 4 or 5 delegated trips to Canberra to visit Department, the Ministers for Health, the Opposition Minister for Health, Department of Health, Treasurer, Finance, Finance Portfolio Holder. We usually go with no more than 4 people, but we usually take our Director of Nursing, we take a researcher, myself as chairman, and we employ on a very small basis a ex-whip of our parliament who also is a prostate cancer survivor, but he knows everybody in parliament, he knows what to do and what door to knock on, so that helps us. We in turn wrote to every politician. During those delegations, we started off talking about 1 in 4 men have access to a prostate cancer specialty nurse. And I realised pretty early on that wasn't catching very much, right? The politicians would just nod, 1 in 4, that sounds pretty good, it's better than 1 in 8. Okay. So very quickly I changed that tack to prostate cancer specialty nurses as a service that you can either avail yourself of or you can't. If it's in your area, you have one. It's green. Right? If you're in an area where there isn't a prostate cancer specialty nurse, you can't avail yourself of that service. And so as soon as we started to talk about on and off, or available or not available, we started to get traction. And I thought I had a slide, but I don't, but I'll try and hold it up for you. What really worked for us was ultimately we sent this map, right, to every politician, okay? And the orange is where we don't have a nurse, and the blue is where we do have a nurse, okay? And behind that, for those who didn't want to look at a map, the only thing we did wrong was the orange looks like it's red. And of course our political parties are red and blue. So every politician got this map. Obviously we had to break out the metropolitan areas. It also indicates to you how vast Australia is in terms of trying to cover, with a nurse, and even the distances that the nurse has to do in some of those regions. For those who didn't want to look at a map, is a page that basically said this is where they are, and this is where they are, and this is where they aren't. And so, the politicians, it was very easy for him to say, well, I'm in the North Sydney electorate, and I do or don't have a nurse. It's not as simple as that once they realise they don't have a nurse. There's a lot of other considerations, but it really made them sit up. And we had a lot of MPs, backbenchers, who then wrote to the relevant ministers in their parties and said, we support this at a local level. So we hadn't done that before, and just an indication of the sort of depth that sometimes you have to get to. No guarantee of anything, but luckily in the budget that was just released, we got 66 nurses, which was a monetary budget. And then the following Saturday, the Leader of the Opposition announced he would match the 70 that we'd applied for, so 66 or 70 is not a major issue. So regardless of the outcome next Saturday week in Australia, our prostate cancer specialty nurses are expanding nicely. Thank you.